Let's start with actinomycosis. So, actinomycosis it is a chronic granulomatous, separative, and fibrosing disease. It is a bacterial disease. So, now let's check what are the characteristics of the bacteria. The bacteria is anaerobic or microaerophilic, gram-positive, non-acid fast, branched, filamentous bacteria. And these bacteria are normal component of oral flora, colon, and vagina. Coming to the etiology of actinomycosis, it is caused by actinomyces bacteria. And from the lesion of the disease, we identify different varieties like Actinomyces israeli, myeli, and Viscus odonoliticus, etc. And the usual pattern of forming this disease is by forming an abscess and then drain out through the sinus tract. And when we examine this pus from the abscess, we can see some sulfur granules or colonies of the organism, and that appear as tiny yellow grains or separation. Now it's a classification. It is based on the anatomical region, and first is cervicofacial actinomycosis, thoracic actinomycosis, abdominal and pelvic. Pathogenesis, that means how the disease is caused. So there will be a disruption of the mucosal barrier and through which our bacteria enters. So in different areas of the body, the disruption will be varying. In cervicofacial, it can be trauma or dental extraction. In thoracic region, it can be aspiration. In abdominal, may be due to the abdominal surgery, and in the pelvic region, it is the usage of intrauterine contraceptive device. Clinical features. Whenever we are writing the clinical feature, we should mention three main headings, that is age, gender and the site. Here, male with a middle-aged group are more prone to the disease, and the site of occurrence, cervicofacial region, is the most prone area, and among that the salivary gland, mouth, skin, face and neck are infected more. And how we can find it? The swelling will be soft tissue swelling with intruded into the tissue, and the color will be reddish purple, and consistency will be so hard like a wood, and that will not fluctuate, and the pain will be no pain. From the figure, we can find a mandible that resembling the lumpy jaw, as it is our clinical feature too. In the case of mandible, the angle of the mandible is most frequently affected, and we can see that coloration, that is red or reddish purple coloration. And when it spread to mandible or maxilla, mandible is more prone to the disease, and if it is spread to the bone, it may lead to actinomycosis, osteomyelitis, and that may involve the cranium, meningitis of the brain. This is a histological diagram of actinomycosis, and the three main features are colony of microorganisms described as ray fungus, and these organisms will be surrounded by polymorphs and the presence of few multinucleated giant cell and histiocytes. Diagnosis and protective factors. The surgical drainage or the removal of lesion is done, and the antibiotic like penicillin is taken for several months or year, and some complication that is faced is meningitis.